Governor Kate Brown now has boosted immunity against the COVID virus.
Thought it was really important that I have the full protection.
Earlier this year, Brown got the single-dose Johnson & Johnson almost as soon as it was available to show Oregonians it was safe and effective. Now she's mixed and matched, getting a Moderna booster. She also got a flu shot.
In talking with my medical provider, my doctor, wanted to try this alternative strategy.
New research all these months later shows Johnson & Johnson, while highly effective, was the least effective of the three vaccines. As a result, anyone who got Johnson & Johnson 2 months ago or before that can now get a booster. The governor's doctor, Ralph Yates, said it is an important step.
I and my colleagues strongly encourage you to get them when eligible.
You can also get a booster shot if you are 65 or older, got your second Pfizer or Moderna shot at least 6 months ago, live in long-term care, live or work in an environment that exposes you to lots of people, or have underlying conditions. But before you run out to your local pharmacy, you might want to go online to see if there are appointments available. I did that with CVS earlier today. I fudged a couple of details to check on openings, entered a zip code for Northeast Portland, and discovered I was eligible for Friday. But when I clicked on individual pharmacies, there were no slots available, and I could not really figure out how to change the date to put it farther out in the future. So beware. At the same time, Kaiser tells me they are booking appointments for both members and non-members, and that there were openings today. OHSU is also giving boosters at the Portland Expo Center Monday through Friday, but all the slots now are filled until November 2nd. I also had a chance to talk with the doctor in charge of rolling out the vaccination program for the White House. He's now rolling out the booster program as well. His name is Bishara Shurker. He said we should know by November 3rd if kids ages 5 to 11 will be eligible for COVID vaccinations with the Pfizer dose. I asked about mixing things up with adults. Finally, if someone has had, for example, a couple of Pfizer vaccinations like I have, is it bad for me now to go get the Moderna because it seems like that gives me even higher protection?
Well, here's what I would say. We have data to show that mix and match of these vaccines is effective. The reality is probably most people who have taken one vaccine will be more comfortable sticking with their same vaccine. That's probably what I'll do.
We'll see, though. It's probably not what I'll do. I'll probably follow the governor's lead and try to get a Moderna booster. Out live now, a lot of people are eligible currently now for the boosters, but again, that doesn't mean they're available. I think there's probably a lot of supply of the vaccine, but just getting people through all these slots is going to take a while, so be patient.
Yeah, definitely. So what are you hearing from the pharmacies themselves, Pat?
Well, I talked with Pat Hubble from the Brooklyn Pharmacy. He's a guy we go to frequently, but he said that he has Moderna in now. He's expecting to get Johnson & Johnson next week, but he, like everybody else, is pretty well jammed up. So you have to go on his website to make an appointment, and he's pretty well full through the end of the week. I also checked in with Providence. Same thing. They're one of the biggest health providers in the area. They said, please go to their website to find out whether you're eligible for a booster, and if so, where and when you can get it.